Okay, we're going to be talking about tumors of the spinal cord. Next, please. So, what is a spinal cord tumor? A spinal cord tumor is an abnormal tissue growth within or next to the spinal cord. Even benign spinal cord tumors can cause serious neurological problems in children because they can put pressure on the spinal cord as they grow. Prompt diagnosis and treatment can prevent spinal cord damage from being permanent. Recent advancement in treatment options, surgical instruments, and surgical techniques have made it easier to treat this type of tumor. Next, please. Classification of spinal cord tumors. Spinal tumors can be classified into intramedullary, extramedullary, and extradural. These can be classified further into either benign or malignant. They will present with varying clinical features, with pain the most common symptom, secondary to direct compression, vascular occlusion, or invasive infiltration of the cord. Next, please. So extradural tumors. They are the most common spinal tumors arising within the vertebrae themselves. While the majority are metastatic deposits, there are small proportion that are primary, both either benign or malignant. Anakin staging scores are used for both benign and malignant tumors, respectively. Next, please. Intramedullary tumors. These arise from within the spinal cord itself. Around 60% to 70% are of glial origin. These tumors are usually slow growing in nature with non-specific presenting symptoms. Due to the compact nature of the spinal cord, any surgical intervention on intramedullary tumors has high risk of iatrogenic injury. Next, please. And then we have extramedullary tumors. These arise from a range of tissues such as nerves, blood vessels, meningeal layers, located within the space between the dura and the spinal cord. They commonly present with pain, however, fortunately, are almost always benign and well demarcated, making them suitable for successful surgical resection. Next, please. Then we have metastatic spinal tumors. The majority of spinal tumors are secondary deposits from distant primaries. The most common primaries that metastasize to the spinal cord are lung, breast, prostate, kidney, and thyroid. The main complication from metastatic spinal cord tumors is metastatic spinal cord compression, affecting around 5 to 10% of all cancer patients, which can lead to permanent paralysis if untreated. Prognosis from metastatic spinal disease can be guided by the revised Tokuhashi score, including performance status, number of extraspinal bone metastases, metastasis in the vertebral body, and metastasis to the major internal organs, the primary site of cancer, and evidence of spinal cord palsy to calculate an overall mean survival. Next, please. So clinical features of spinal cord tumors. The most common presenting feature is pain, typically long-standing and localized, dull in nature, and potentially aggravated by supine positioning. Those with nerve root or spinal cord compressions may also develop motor symptoms, weakness or paralysis, loss of sphincter function, and sensory symptoms, paresthesia. In malignant lesions, systemic symptoms including weight loss or fatigue may be present. Ensure to complete a full peripheral neurological examination, noting levels of any neurological defects present. Documentation of any red flags of back pain is very essential. Next, please. So the treatment. We have non-surgical treatment, radiation therapy. This may be used to eliminate remnants of tumors that remain after surgery, to treat inoperable tumors, or to treat those tumors where surgery is too risky. Medications may help ease some of the side effects of radiation, such as nausea and vomiting. Sometimes radiation therapy regime may be adjusted to help minimize the amount of healthy tissue that's damaged and to make the treatment more effective. Modifications may range from simply changing the dosage of radiation to using sophisticated techniques such as 3D conformal radiation therapy. Next, please. Then we have chemotherapy, a standard treatment for many types of cancer. Chemotherapy uses medications to destroy cancer cells or stop them from growing. Doctors can determine whether chemotherapy might be beneficial, either alone or in combination with radiation therapy. Side effects may include fatigue, nausea, vomiting, increased risk of infection, and hair loss. And then we have other drugs because surgery and radiation therapy, as well as tumors themselves, can cause inflammation inside the spinal cord. Doctors sometimes prescribe corticosteroids to reduce swelling, either after surgery or during radiation treatments. Although corticosteroids reduce inflammation, they are usually used only for short periods to avoid serious side effects such as muscle weakness, osteoporosis, high blood pressure, diabetes, and an increased susceptibility to infection. Next, please. Then we have surgery. This is often the treatment of choice for tumors that can be removed with an acceptable risk of spinal cord or nerve injury damage. Newer techniques and instruments allow neurosurgeons to reach tumors that were once considered inaccessible. The high-powered microscope used in microsurgery make it easier to distinguish tumor from healthy tissue. Doctors can monitor the function of the spinal cord and other important nerves during surgery, thus minimizing the chance of injuring them. In some instances, very high-frequency sound waves might be used during surgery to break up tumors and to remove the fragments. But even with the latest technology advances in surgery, not all tumors can be totally removed. When the tumor can be removed completely, surgery may be followed by radiation therapy or chemotherapy, or even both. Next, please. Thank you very much.
Okay. Reconnect your Zoom session, please.